Thank you, Alan, and thanks to the organizers here. Yes, it's true. I talk about this subject at length. I think I used to keep track of how many talks I gave. I know it's over 100, but I think that demonstrates the importance of this issue to the community. And really what our regulation that we have at NIH is about is an extension of the regulation to you as the community. It's the institutions and the community that is really driving the issue when it comes to managing the conflicts of interest. So I normally go to a blank slide because I should give my disclosures, and my disclosures as a government employee, I have none to disclose. I have no relationships to disclose with industry or with others. I hope that no one will turn me in if I drink a bottle of water here today at the meeting, but I also want to thank Bernie for the IOM study on financial conflicts of interest. It was a very thoughtful study, and it really helped us in the creation of the next generation of the regulation. Neil, thanks a lot for really putting this in a practical context of what this really means to the community. And I also want to thank Heather Pierce, who you're going to hear from, and AAMC, who's really been working on bringing the community together to talk about metrics and best practices, which is the way we're going to have to drive that. And again, today you're going to be talking more about that as we go on. So just to remember that we have entered into the concept of the regulation for financial conflict of interest, in that the relationship between the academic and industry is important, as Neil just pointed out, and the public benefits when academic researchers collaborate with industry to develop innovative products. So we talk a lot about this because when we developed the regulation, which has actually been in place for almost 20 years now, the idea was not in some way to stifle these relationships that are going on, but in really just enhance what we know are the relationships and be able to manage them appropriately. So when we think about our regulation, number one probably, I also want to thank Bernie for putting up a picture of Senator Grassley. I almost forgot what he looked like, so thanks again for that. Maintaining objectivity in research is equally important as the relationship between the industry and academia. And as Neil pointed out, one of the things, and Bernie both pointed out, one of the things that's of utmost importance is maintaining public trust. And I think with dealing with patients or with dealing with the public in general, we want to trust the researchers, that the research is going to be objective. And our regulation is actually called promoting objectivity in research. And I think one could argue whether promoting objectivity and preventing bias are the same thing. I think that would be an interesting discussion to have, or whether promoting objectivity and financial conflict of interest is the same thing. But that's really how we approach it. So we're looking at it as an outcome. We're looking at an outcome of producing research that is objective, and that's really our goal. So we think oftentimes about this regulation as promoting public trust because we're going to preserve and promote objectivity, and we're looking for that outcome ultimately. So, but when we think about it, it does promote the integrity not only of the institution, but of the investigator themselves and the data, and those data that are coming out from these studies, that the data is also preserved as trustworthy. And then, of course, we as an agency also get into the business of course, we're a public agency, and we want the public to trust what the research that we're generating. And then ultimately it provides transparency. And you'll see, I'm not going to go into great detail about the changes in the regulation because it's been in place for a number of years now, but one of the points about it is to increase the transparency of what we're doing and how we're doing it and what those relationships are between the investigators that we support and industry. So the big bad government swooped down on us and you many years ago, actually in 1995. So the regulation was in place since 1995, and we worked towards a new regulation that, as a result of many of these common misperceptions that were happening in the community. So I think Neil already pointed this out, and Bernie, that a financial interest is not always a conflict. So we saw Bernie's slide where you saw the large circle and the small circle where bias was. So we're in that same business. Conflicts of interest or conflicts of position are going to happen, in the community, and so they're not always, a financial interest may not be a conflict, particularly in our world, because the financial interest has to relate to the research that we're funding. So it's not always a conflict. And somehow this idea that if there is a conflict of interest, instead of managing it, it becomes somehow misconduct, that the investigator is bad, that something, that you should not have these relationships because they're ultimately negative. So we have really been in the business of trying to change this perception that, again, it is not about the idea of not having conflicts, but it's about how you properly manage those conflicts. And then the other issue that we dealt with specifically in this round of the regulation was that somehow NIH should actually be managing the interests of the investigators we support. We are in the business of, our relationship basically is with the institutions, and as you're going to see, a large piece of the responsibility of our regulation falls to that institution, and that's really, really important. We had individuals that came to us and said, you should be collecting all the financial interests of every single investigator that, or a key personnel that is involved with your research. First of all, it's impractical to do that, but secondly, we are not in the context, we are not in the world that you live in. You know the relationships that your investigators have, you know the world of their research and the environment of the university or of the organization, and that's where these responsibilities should happen. So, again, we're the only agency that really has this type of regulation governing research, and it's a department regulation. Remember, it's not just NIH, but it's a departmental regulation for all of HHS. It was promulgated in 1995, and then we again revised it in 2011, and you all had a year to implement it, and we really worked with you very closely. This is important to us and was important to you. We worked with you very closely over the course of the year to tweak a few of our frequently asked questions when we saw issues coming up, to clarify what this regulation meant. And I believe we've been successful, and you all have been successful in implementing the new regulation last August. So when we describe them, we say these regulations promote objectivity in research by establishing standards that provide a reasonable expectation that the design, conduct, and support and reporting of research funded under PHS grants or cooperative agreements will be free from bias resulting from investigator financial conflicts of interest. So there's a couple points that are important there. Bias is mentioned in there, but that reasonable expectation. So again, this goes back to the idea that there are conflicts that are going to arise, and the management of them gives you that reasonable expectation that we are going to have objective research in the design, conduct, and reporting of that research. So just to remind you just a little bit about how this works. So the investigator discloses their significant financial interests to the university or to the institution. This has been in place since 1995, although we extended it from just those responsibilities, significant financial interests that pertain to their research, to all significant financial interests that pertain to their institutional responsibilities. And this has been really critical because we just had a case in the last month whereby a university who was managing financial conflicts of interest came to determine that certain interests of their investigator had not been disclosed because they had a knowledge of things going on, and when they went back and looked at all the disclosures for the last 2 years, realized that that individual had not disclosed things, and it's become a huge publicly facing issue in the last month. So this is a preventive strategy. Again, we are looking at a way to think preventatively about managing these relationships up front so that we can assure the objectivity in the past. We're taking a proactive approach, and you all as institutions are taking a proactive approach. So the investigator also must be in compliance with their policy, so they must be disclosing at the appropriate times to their institution. But remember, again, they're only disclosing to their institutions. The institution has the major role. The institution, this disclosure and the broadening of the disclosure in the 2011 reg has allowed the institution, as we heard earlier, to identify relationships that they may have not otherwise known existed. And you'd be surprised. When we just started talking about redoing the regulation, our number of financial conflict of interest reports skyrocketed to NIH. So these things were happening out there, but they were not being reported to NIH, and it was just simply the thought that we were going to go through this regulatory process that really brought the institutions and the investigators on board to disclose appropriately and to report to NIH appropriately. It was incredible what happened. But they have to have an institutional policy. They have to implement that policy. They must train their investigators and others involved in research. And then one of their most critical steps, which we've talked about earlier, is looking at that financial interest and determining whether or not there is, they're really assessing the risk. Is this constituting a financial conflict of interest? And if it is, then they must manage it. So we are setting a floor here. We are not telling the institutions how they must manage their conflicts of interest, and that's why it's good for groups to come together to talk about best practices, because really there are some institutions that have been very strict and are really almost restricting relationships with industry, and others that are in the true business of managing. The regulation really says you must manage, but we don't tell you how to do it. And then you report to us what that if it generates a conflict of interest, only time you report to us if there is a conflict of interest identified, financial conflict of interest, and then you tell us what it is and you tell us how you're managing it. In the past, we didn't ask you how you were managing it, but now we do, and that's very important to us because it also lets us assess where there's some trigger points and where there's some issues that we might either need to work with you on or to be able to help you with best practices. What are the most common things that are generating conflicts of interest? That would be of interest to know, I think, by the community. And then as the regulatory agency in this case, we manage the entire process. So we assure that your policies are in place. We can do compliance on these policies. We take a look at it. We're not an auditing group. We're not going to be there on your doorstep saying, where are your reports? We are going to do some compliance and some targeted compliance as well as some proactive compliance, but our job is to really oversee the process. So there's some interesting things because because we have this regulation, we're sometimes fall into a category where I think some in the public think the government is a bit schizophrenic. Because on one hand, back in the 80s, when we promoted buy dole, we were really promoting buy dole as a way for not only investigators across the country and world to incentivize them to work on government issues, but buy dole also is a way to manage relationships with industry and with the government. So it promoted the thought that academic researchers would work on government issues, and it also opened the door for a lot of growth in the relationship between academia and industry. On the other hand, then we had the conflict of interest regulations, and now we have our new NCATS program, which is our National Center for Translational Research. And for example, one of the centerpieces of the NCATS program has been our new therapeutic uses program, which there's 8 companies that are part of this, and basically what it is those companies have opened up their libraries of molecules and compounds that have gone through a lot of preclinical work but have fallen out because of efficacy, and they've opened up those libraries to academic researchers who can take a look at those compounds and perhaps repurpose them. And the idea, of course, with that 15 to 20-year pipeline is to take all that research that was already done in the preclinical space and then to be more rapidly be able to use these compounds for other purposes or reuse them in some way. So here we are promoting, and so basically what this did was take the idea of one researcher working with industry to opening up the world of researchers with industry. So we're saying anybody can come, any researcher can come that has interest in these compounds, and we can try to develop this relationship. Now, at the same time, we had to develop some model template agreements for the intellectual property because we had to also incentivize industry to be able to open up their information libraries of compounds to us and to the academic organizations. But then the question came, well, when you have this financial conflict of interest? Why are you promoting programs that will do this? And again, the issue with this is we were very cautious when this program came out to say that those that are involved in this program are going to have to pay attention to our regulation and our policies and your policies at institutions, and make sure that those relationships which we're now promoting are managed correctly. Again, it's not that you cannot do that, you must manage those relationships. And so we did not feel in any way that this was, that our financial conflict of interest regulation should in any way deter individuals from participating in this program. And indeed, we've seen just an enormous response to the program, and we've had more and more companies coming on board as well. So in fact, we believe that under the environment of having elevated conflict of interest, this gave people much more peace of mind that we were going to be able to approach this new program and manage whatever conflicts of interest might arise in appropriate ways. So it's really been a very, very interesting endeavor. So that's really all I have to say. I'll be happy to answer any questions people have along with the panel, and I think having this discussion today that is going to promote best practices and looking at ways to do things better, I think is going to be wonderful. So I really encourage you to have a in-depth discussion this afternoon. And although I can't stay for this afternoon's session, I would encourage whatever's learned in these sessions. We have a lot of interactions with many of you, and we're always willing and want to hear and learn from the community as we go forward on this in this area. So thanks a lot.